Good evening. Today we will be discussing about patent ductus arteriosus. So what is patent ductus arteriosus? It is a congenital heart defect where the ductus arteriosus does not close after birth. This will lead to an increased pulmonary blood flow. So first we will discuss what ductus arteriosus is. So ductus arteriosus is a blood vessel that connects the aorta to the pulmonary artery in a fetus. So in the fetus, its purpose is to carry blood that is entering the right side of the heart to the rest of the body. Because in fetal period, the lungs is not functioning, it allows the blood to bypass the non-functional lungs in the fetus. It is present in all newborns, but it should close shortly after the birth, usually within 3 days. But if it doesn't close after birth, it is considered as patent ductus arteriosus, which is a congenital heart defect. So here, as we see in this picture, there is a connection between the aorta and the pulmonary artery. So this is patent ductus arteriosus, the connection between the aorta and the pulmonary artery. So normally in the heart, in the right atrium, the deoxygenated blood comes and from it enters the right ventricle and through the pulmonary artery, it goes into the lungs for oxygenation and returns to the left atrium and then comes to the left ventricle, and the oxygenated blood gets circulated to the systemic circulation through the aorta. But here what happens is there is a connection between the aorta and pulmonary artery. So some amount of oxygenated blood will enter the pulmonary artery through the patent ductus arteriosus. So there is an increased pulmonary blood flow. So this is what happens in a patent ductus arteriosus. So when there is an increased pulmonary blood flow, there is there is a stress on the or a strain on the pulmonary artery that will in turn lead to narrowing of the pulmonary arteries, which will result in pulmonary hypertension. Okay, so this is what happens in patent ductus arteriosus. So patent ductus arteriosus is commonly seen in premature babies, and as we already discussed, there is a shunting of the blood from left side of the heart to the right side of the heart, that is from aorta to pulmonary artery. So the signs and symptoms in patent ductus arteriosus includes a continuous machinery murmur or a machine-like heart murmur found at the left upper sternal border. It is a continuous murmur heard both on systole and diastole, and also because the diastolic BP drops, there is a widened pulse pressure. So what is pulse pressure? According to the Open Journal of Pediatrics, pulse pressure is the difference between systolic and diastolic pressure of more than 15 to 25 millimeters of mercury in a premature infant and more than 25 millimeters of mercury in a term infant. So in PDA, what happens is because of the drop in diastolic BP, there is a widened pulse pressure. And also because heart has to work too hard to pump the blood, there is also a risk for increased heart rate. And these patients are at risk for developing endocarditis and also heart failure. There is pulmonary hypertension and also an increased risk for lung infections. These children usually get lung infection